Stephen Oliveros, and this is my project on hepatitis A, B, C, and E. So, today we're going to be talking about the different forms of hepatitis, which are A, B, C, and E. Here we're going to start with hepatitis A. It is a vaccine preventable liver infection. It is usually transmitted from feces and food in which targets the liver. It travels through bloodstream and gastrointestinal tract. Usually, a food handler that doesn't have proper hygiene will cause hepatitis A, and the symptoms are lethargy, nausea, vomiting and discomfort, and jaundice. So now we're going forward with hepatitis B. This is also a vaccine preventable liver infection. It spreads when blood, semen, or other bodily fluids from an infected person gets transmitted to somebody who is not infected. It also has the same symptoms as hepatitis A. Then we have hepatitis C. This virus attacks the liver and leads to inflammation, usually contracted by being in contact with contaminated blood by sharing needles, surgical equipment, or unsterile tattoo equipment, and so on. And then we have hepatitis E. It is also an inflammation of liver, transmitted by drinking contaminated water with fecal matter. This is most common in third world countries. So some patient precautions when we're handling hepatitis patients are to wear gloves, use goggles, and always wash your hands before and after handling the patient. So the image modalities that we use for patients with hepatitis are MRI, CT, and ultrasound. For MRI, the patient will be in supine position. MRI uses a non-ionizing radiation and takes pictures of the size and density of the liver. Then we have CT. Also, we'll have them in supine position, and we ingest the contrast through the intravenous to visualize the liver and biliary tract. So you can see here we have the CT image and we have the liver right over here. Then we'll use ultrasound. It evaluates the abnormalities in the liver and detects fluid buildup due to liver failure. So you can see we have the liver right over here. The treatments for hepatitis A, well, there is no specific treatments. It only takes recovery for a couple of weeks or months, and always to avoid unnecessary medications. Then we have hepatitis B treatments. For the most part, it clears on its own, but if it is contracted within 12 hours, then you will get injected with immunoglobulin. If infected before becomes chronic, then several medications will be issued, which are Baracludin, Virine, Epivir, Hepcira, and Tizakin. If the treatment fails, then liver transplant will be issued. For hepatitis C, a painful shot of interferon might be injected. Also, an oral medication called ribavirin, but more than half of the time a liver transplant is needed. For hepatitis E, there is no specific treatment. It clears on its own, but it is advised to rest, drink fluids, avoid alcohol, and acetaminophen. In conclusion, contracting hepatitis can become a very serious issue in your life if one day contracted. If contracted, please visit your doctor as soon as possible, because if it is left untreated for a long time, it can become very serious and cause liver failure or liver cancer. So here we have a normal liver, and then here we have an inflamed liver. And we can see a liver that is infected with hepatitis. First it goes chronic, then it goes to cirrhosis, and then it becomes fatal. Thank you.